It really is a terrific crowd. So let me start. We have 10 minutes, you said? 4.5. Yeah. So let me jump past there. I was looking at the. I'm sorry. Okay. Let me stand here. Look down a little bit. I was looking at things to consider. How do we advance the area of health 2.0? There were a number of questions. I only have 5 minutes, so I boiled it down to 3 that I tend to look at. But some key things are we asking the right questions? And I've seen a lot of people thinking activity equals productivity. They're doing a ton of things in the Health 2.0 area. Not everything is equaling the same value. And so I think we really need to take a step back and look at what really is lining up with our business needs, and then staying sharply focused on that and figuring out what exactly can we do to really advance our missions. Another is, are we establishing the right partnerships? And it's kind of like the law of cause and effect. If you want to see the effects that are happening out there that you want to match, make sure you identify who's causing it and tie with them. At FDA, we've done a tremendous amount of work by begging, borrowing, stealing, and paying other individuals to help us use our infrastructures, help us bring ideas back into what we're doing, and it's completely helped to advance a lot of what we're involved with. And then also we focus on the right technologies. What I wanted to do is spend some time talking about what areas of investment we're currently making. 4 key areas. One is making sure we have the right content, making sure information is shareable, going mobile, and then also really embracing open government. I spent a lot of my career telling people that content is key and information technology, you got to focus on the information. I don't know if that's completely true. We have way too much content these days. We've got organizations producing content. We've got users now producing content. We've got aggregators. There's just a lot of information, and a lot of it isn't engaging. A lot of it isn't persuasive. A lot of it really isn't drawing in audiences. So we really have to look at our content. What I have here is a key set of content that tells that FDA we've got the authority to regulate tobacco products. There's this 84 pages that is a wall of words of the authorities that FDA has been given to regulate tobacco. It's got tremendous information in it, but nobody's reading it. And for the last year or so, it's very acceptable to have this up on the web. What we've done now is really look at how do you layer that information, bring out summaries and timelines. How do you actually not only make it a usable format, but then also how do you create faceted search structures around the entire set of content, since it really drives a lot of our activities, and make it so much easier for people to look for information, whether it's by audience type of tobacco or topic, and really drive them to great information. And I continue to see a lot of information once you drive people from those different social media networks to very bad content on our websites, and people immediately jump off. The secondary shareable content idea here is how do we create content once and share it many times, and not just content but also tools and resources. Here's something that we've borrowed and stolen from CDC, but it's the idea of using a content syndication platform that allows all of our partners to grab our content and resurface it under their headers and footers. And basically, you're seeing information on different state websites or on CDC's website. It's our content under their headers and footers. We update our content once, it updates on their page automatically. We're doing the same thing with a lot of widgets, and we're finding a lot of this stuff very, very popular, and really, with the loss of funding across the different community levels, we want to make sure this is continuing to happen. Mobile, you see the numbers, 96% of Americans have mobile access, 35% on smartphones. When in Rome, you do as the Romans do. We're moving a lot of our information out in that direction. This is an example of us not just using text messaging around our programs, but also tying it to recognition prizes, so that we incentivize people to come in and join some of our texting programs. We're also, this is a widget we've created, but it also serves now as it's going to be converted into an iPhone and Android app. And basically, it allows retailers to subscribe to, allows them to basically join a pledge that they're going to be responsible retailing around tobacco products, and then you can see geospatially where exactly they've made the pledge and who else is doing that level of work. We're also doing a lot of research and development beyond just the mobile phones, but also with the Kindle, with an iPad. What situations really require an app environment? What actually requires seeing things in much broader space? Allows for much more content uptake, or different types of activities. So it's another area we really want to try pushing to make our information on the go. And finally, open government. We all see government as a service. I think what you're hearing a lot from government now is it also is a platform and a facilitator. How do you make our information not just accessible on our sites, but what can entrepreneurs and others do to use our information in much more creative ways than we could? And so setting up our services as a platform, facilitating people coming together, looking at our data and doing creative things with it, with incentives, is an area we really want to push. I won't go through some of these. These are different ideation platforms and web dialogues we've done to bring people together. But generally, one of the cool things we're doing in FY12 is looking at how do we take a lot of our content libraries for mobile technologies, taking a lot of our e-cards, text messaging tools, and enabling it for reuse at the local level. So we create a platform like data.gov, or maybe it's data.gov, and enabling a lot of people to grab this stuff, reuse it at the local level, and help us to advance our mission. That's it. I'm going to turn over to Mike, and I think I'm at the deadline. So
yeah, great job.